What are the most important blood tests to get, and how often should I order them? So I think anybody with a serious disease like cancer should get fairly regular CBC, which is a complete blood count, and CMP, which is a complete metabolic profile, on a fairly regular basis, meaning that depends on your condition how regular that is. If you have abnormalities in either of those tests, you should do it, you know, at least monthly. Spoke to someone, a few months ago, and they had, pretty strong abnormalities on their CBC and their complete metabolic panel. And the test was done, by their oncologist. The oncologist never went over the labs with the person. I was sent to labs. This was now, I think, 5 weeks post draw, meaning 5 weeks after that draw was done. And you know, none of them were reordered. Why are you ordering them in the first place if you're not looking at them to make some analysis of them? And certainly if the person has, fairly distinct anemia, you better be running them again. You don't know, sometimes you should be running them weekly. So, um, so it depends on what's going on. If the person has fairly severe anemia, you should be really running them weekly, maybe every 2 weeks, but you need to be keeping an eye on your patient. So I don't get it. You see that very often with people that are working with an oncologist. The oncologist will order labs. There's abnormalities on the labs, and either they're not addressed at all, or they're not reordering labs after maybe they're told, oh, you have anemia, you should be on iron, but don't you look at them again? I don't know. So the complete wellness panel that you can order off of our site has a CBC with differential, complete comprehensive metabolic profile, and a bunch of other things that I think are beneficial. Um, so for somebody just to get a good wellness panel, getting that run can be very helpful. Also, it depended on what's going on. If you have cancer and you have shown tumor markers positive in the past, either doing a female tumor panel or a male tumor panel, depending on your gender, adding that to your protocol as well. If you're especially a female and you're dealing with um, hormone positive cancers, then consider doing a Dutch profile. The Dutch complete is a good, complete hormone profile, though um, that doesn't have to be done as often. So this really needs to be done just as needed. Wouldn't be something that you would look at on a fairly regular basis if it was within normal limits. Then I would say maybe every 6 months, and you could even push it out to a year if everything was normal. Your tumor markers, it all depends on if you're using those to kind of guide your cancer care. If those show up positive, getting those done on a monthly basis could be helpful. But certainly the complete metabolic panel and the comprehensive or the CBC would be done on a more regular basis. The question that came to me directly was recently a CBC result showed some markers like ferritin to be extremely high. If I send you those CBC results with a cheek swab, can you just add additional supplements, or should I schedule a call? You should probably schedule a call. Send me those results. Now I have a software that I put all those results in that is really kind of cool, and it gives you a really nice readout. Um, and more often than not, some of these things aren't being addressed. So if ferritin is very high, what does that usually indicate? Well, that usually indicates some people think that ferritin is only an iron marker. While ferritin can indicate iron levels and iron transport levels, because that's how iron is transported, typically if ferritin is elevated, it's an inflammatory marker. So if ferritin is elevated and you're currently taking iron, make sure that you stop taking iron. So, but send me those and we'll and then schedule a talk that we could go over that.